All right, so it's 8:01. We'll get started. We have quite a few people that have joined us, and for anyone else who comes on, they'll catch up. So, hi everyone. Thank you for joining us tonight. My name is Melissa VanDusky. I am with the academic team for Aspen Dental. I work on the specialty team. My official title is Academic and Industry Relations Manager. That's just kind of fancy term for the relationship between Aspen and the academic world, specifically for oral surgeons and endodontists in their residency programs. So I'm just happy to be here with you all tonight, and thanks for joining us. I have Seth Cowan with me tonight as well. Go ahead, Seth, introduce yourself.
Hi, my name is Seth Cowan. I've been with Aspen Dental with close to 15 years. In June 2015, I shifted over from general dentistry to specialty and have loved every second of it. So myself and my team will do the recruitment, put candidates through the interview process, and do the hiring for both endodontists and oral surgeons. So super excited to be with you tonight. So happy to have Dr. Case on. I think we're going to have a great time.
And before I introduce the woman of the hour, should I say, Dr. Case, I just want to let everybody know that I'm kind of like looking in all different directions here. So if you see me looking a little bit all over the place, it's because I am. It's like mission control over here. I have the questions popping up on one side, and so I have to manage a bunch of different things here. So if I'm not looking right at you, that's why. Without further ado, Dr. Emily Case, can you just introduce yourself and give us a little background?
Yeah, my name is Emily, and I am an endodontist here in Portland, Oregon. I went to the University of Iowa for dental school and for my residency, and that's actually where I'm from, is Iowa, a really small town in Iowa, but I moved out to Portland with my husband, and we love it.
Nice. And how long have you been with Aspen?
Just over a year, well, like a year and a half almost.
I see, it flies by, right?
Yeah, it does.
All right, so did you come to Aspen, oh, it's starting to rain over here. Did you come to Aspen right out of residency?
No, actually, I was in private practice for 2 years, and then I was in private practice, and I was kind of like the third doctor hired, and so towards the end of my 2 years there, I picked up Aspen part-time just to fill my time, and then I liked it so much that I decided to transition to Aspen full-time. So
nice.
That's what I'm doing now.
We like to hear that.
Yeah.
So for all of you that are out there watching and listening, there is a question and answer little button on the bottom of your screen. So that's how you can pose questions to Dr. Case or myself or Seth. So yeah, just send over the questions and I'll get to them. You know, hopefully I can get to all of them. We'll see. If I don't, I will get to you afterward, one-on-one. And the questions kind of come in random, so this is in no particular order. I try my best to group them together so it makes a little bit more of a cohesive story when you're answering them, Dr. Case, but sometimes they're just all over the place because we're kind of throwing them at you as they come in. Okay. So we will get started on some of these questions coming in. So the first question we have is, how many offices do you cover, or how many offices can you cover as an endodontist?
I cover quite a few. I guess I don't know how many full-time Aspen endodontists usually cover, but right now I have 8, and sometimes I have 9. So one of my offices, I kind of stopped going there for a little bit just because their general dentist did a lot of endo, so I wasn't very busy. So I've dropped that, but they're getting a new dentist, and they don't do any endo, so I'm going to go back there. So typically, well, in a couple months, it'll be back to 9 offices.
And are you at those offices how often?
I'm at those offices I would say half of them like twice a month, and then half of them once a month. And there's one office that is very, very busy. And so I'm there 4 times a month, almost every week at that office.
Oh, nice. So is it kind of like just driven by the patient need and what the office needs are?
Yeah, yep. It depends on what the offices are. Some are more busy than the others. And it also depends on the dentist, you know, if they do any endo, but a lot of my dentists don't do any endo. And then since COVID happened, the ones that did do a few endos stopped doing them altogether too. So it's really nice actually for an endodontist because you get all the cases and you're not getting all of the, you know, cases that are messed up or anything like that. So get a fresh start. I like it.
Yep. I mean, listen, that's one positive for you in this COVID situation, right?
Yeah.
But we have a few questions coming in about COVID, obviously, but we'll kind of get to that later because I want to group those together. So let's see. So on the note, what you just spoke about, the general dentist maybe doing some endo. Can you talk about how the relationship works between you and the general dentist that work in the offices, and who determines who does what endo procedures?
Yeah, so for the most part, I do all endo procedures. If they know it's a straightforward root canal, or they're pretty sure it's a root canal treatment, then they can schedule it for treatment. But if they're not sure, then I have them scheduled just as a consult first, so that we're not kind of wasting time throughout the day. And then also retreats. I just never know really until I see the patient whether I'm going to do a retreat or a surgery. So I schedule all of those for consults. And most of the time, you know, the front desk, as long as they know how to talk to the patients and explain, like, she's not sure exactly what you need, so she's going to decide at this appointment, and then they'll do treatment whenever they can fit it in. But actually, a lot of times, you know, I have time at the end of the day where I'll squeeze people in, and I'm usually willing to stay late. My assistants, I have two of them, and they're willing to stay. At least one of them is willing to stay late if they need to. So my team is pretty flexible, which I really like.
Nice. So in reference to your assistants, we have questions coming in about that. How many assistants do you work with? Do the same assistants work with you in your different offices? And do you get to choose your own assistants? Kind of a 3-in-1 there.
So I have two assistants that travel with me to every single office. And if they didn't, I don't think I could do this, honestly. It's like way too chaotic if I had to go to a different office every day with different assistants. But my team is awesome. My two assistants are great. They travel with me everywhere. I've trained them. They're like so on top of things. They know how to schedule things before each day. They've prepped and done paperwork. So they go through their med history. They make sure everything is, you know, ready for them. If I get outside referrals, they're making sure that information, the referral stuff is set up and available, and that the front desk has put all that information in, and they know what codes need to be put in. So we kind of can make sure that the patient is aware and all the correct codes are put in. So we don't have, you know, patients where they show up and they aren't sure how much, or they get surprised basically with extra codes. We don't want that to happen. So we try to prevent that, and they're really, really good at preparing all of that. I'm
That's
guessing
awesome.
I missed.
No. That is it. How many assistants, and do you work with this? Oh, and did you get to choose your assistant?
Oh, did I get to choose them? So technically, you guys told me that I could bring my own assistants, but I didn't have my own assistants to bring. So the first one that we hired, I kind of interviewed. I mean, sort of. And she seemed really good, and the dentist that she worked for at Aspen had really good things to say about her. And I mean, she is great. And then the second one, she helped me out actually on like the first day because my original assistant was gone that day. And then she said she wanted to stay on, and so we asked her to travel with us as well. So, I mean, yeah, I have say. So if I didn't want them or didn't like them, then I could get somebody new.
Sure. But you're happy with the ones that you have, which is great.
Yes, very happy.
Yep. So you mentioned about kind of like scheduling. So a few questions came in that regard. There's a couple of repeats here. So just to kind of try to condense them. As far as scheduling goes, how does it work with, basically, how is your schedule built out? Is it something that you're doing? Are the people that work for the office on the general dentist side scheduling? Do you have autonomy over your schedule?
Yeah, actually, I make my own schedule. So as far as the days I want to work, I print out the calendar or make the calendar each month, and the RMs or the regional managers approve it, and they give me suggestions if I need to change anything. But for the most part, it's super flexible. I can work whatever days I want to work, basically, as long as I'm working the amount of days that I need to work. And then as far as treatment goes, before COVID happened, I was doing 1.5 molars and then 1 hour anteriors and premolar appointments. But since COVID happened, I've just changed everything to 1.5 hours because I want to make sure there's enough time in between to make sure everything's sterile and clean, and that patients aren't overlapping at all. And actually I kind of like the 1.5 hours a little bit better, just because it gives me just a little more time to write some notes in between patients if I need to. But yeah, 1.5 hours for treatment. And then my consults I schedule in an overflow column, and I overlap them 15 minutes at the end of a treatment appointment and 15 minutes at the beginning of a treatment appointment. So they're 30-minute consults. I probably spend a little more time with patients in the treatment column as far as like my 1.5 hours, but I actually like to talk to patients and explain everything that I'm doing so that they know what they're doing or what I'm doing. I probably talk to patients a lot more than most dentists or specialists do, but I really want them to understand what's going on and what they're here for. So I think it's really important for that aspect, and that's probably why I have a little more time than most people.
Yeah, but I'm sure the patients appreciate that, right? And it kind of eases their nerves a little bit.
Yeah, definitely.
So when you do a consult at any of the 9 offices, do you have access to CBCT? And if not, how do you go about getting a CBCT ordered?
So originally when I started, I only had one office that had cone beam, which was disappointing for me for sure, because I'm used to having it all the time. And then now I actually have 2, and they happen to be like one in my southern region and one in my northern region, which helps a lot. But if I ask patients if they're willing to travel to those offices for it, and most of the time they are, because a lot of places I work are kind of a little more, they're not rural. Like my Portland offices aren't rural, but like my southern region are a little more rural. So they're willing to travel. But if they're not, I have found endodontist offices that I work with for that. I'll just reach out to them and be like, hey, are you willing to take cone beams for me if I send patients over? And so far, all of them have been great, and they've been like, yeah, anytime. So I just reach out to whoever the local endodontist is and work with them.
That's great. That's nice of them that they're willing to help out. Just to add to that, so that is a company-wide initiative right now. So as Dr. Case mentioned, when she first started, I think you said none or only one of your offices had a cone beam.
Yeah.
And now we're one. Okay. So and now we're starting to get them in all of the offices. So that is something that all of our offices will have in the very near future. All new offices that are being built with the cone beam. And then the older offices are being retrofitted for them now. It's just a little bit of a process to get them all stocked up. So that is something that you will have in all of your offices hopefully very soon.
Yeah, that would be amazing.
Yeah, it's coming. What percentage of cases do you do primary treatment and not retreats?
Since I'm doing pretty much all endo treatment for these offices, most of my treatment is just primary root canal treatment. I would say retreats and apicos together, maybe like 15%. I would say it's pretty low. I don't do them too often. I mean, I do them enough to like stay on top of it, but definitely doing a lot more primary root canal treatment.
Great. Okay, so let's see. So we were talking before about like referrals from the general dentist side. So the question that came in was, how do outside referrals work? And I guess I'll add to that. Do you get referrals from outside of the Aspen network, which you mentioned before that you did? So kind of like, how does that work? And also, what are the benefits of having the built-in referral network with the Aspen Dental general dentists? Kind of like, you know, where do you get patients from, and what are the benefits of both?
Mhm. Yeah, most of the patients are from the Aspen dentists, but I do get outside referrals, and most of the time it's patients, their insurance, they call their insurance and they're like, who takes it? And I'm like the only one in thousands of miles. So they drive to me. But that's how I get a lot of my outside referrals. There are a few offices, especially in my really busy Eugene office where I'm there almost once a week. There's sorry, I just lost my train of thought for a second.
Okay.
My really, really busy office in Eugene, I have gone out to a few of those dentists that have referred things to me, and I've met them, and they've kept referring to me even though there's other endodontists in town, just because their patients have been really happy. So I do like to, it's hard for me to reach out to the general dentist in those areas because Eugene is 2 hours from where I live. But when I'm down there and I have some extra time, I'll go out and meet them just to say hi, or go meet their front desk just to say hi and bring them some treats or something like that. Yeah, I do get some outside referrals, but most of them are from inside.
That's great. Let's see. Do you see pediatric patients as well?
I do not, well, okay, so only if you have permanent teeth. If you have only baby teeth, I'm not touching those. But I did just see, it depends, you know, I make sure that they're cooperative, and as far as behavior, that I can manage that. And if they can't, then I'll refer them somewhere else. But I did just see a 7-year-old, and she was better than most adult patients. So it just depends. I'll do a consultation, and if they're good and they'll behave, then I'll do treatment. But if not, then I'll refer them out.
Okay, cool. You'll have to tell me how you get the kids to behave. I could use some pointers for my own. So we spoke a little bit before about consults. So the question is, are endodontists doing their own consults, which I know you mentioned before that you are, but are there ever instances where the general dentist is doing a consult for you?
No, even if they've seen the patient for their initial exam and their chief complaint is this tooth that needs root canal treatment, I always do my own exam. It's just, a lot of times when you're an endodontist, you get referred things and it's actually the wrong tooth or something like that. So every single time I'm doing my own exam.
Does Aspen provide you with a microscope?
Yes, and if they didn't, I would not work here. So yes, absolutely. And yeah.
Okay. How many operatories are you working out of, or can you work out of?
I usually have 2 operatories to work out of. One I use for consults and one I use for treatment. And my assistants are very good about turning things over pretty quickly. And usually there's enough time in between to kind of get everything turned over in my treatment operatory.
Okay, so we have a question about equipment. Do you get to choose your own equipment? And then another question about what are you traveling with as far as equipment goes, or instruments?
I travel with pretty much everything that I'm using. Each office has its own microscope stand, so I don't have to carry that, but I carry the microscope head, and it's in a little suitcase that's padded, so it doesn't get damaged or anything like that. But all of my other stuff I travel with, I have like a tote, like something Aspen gave me. It's on wheels and it kind of stacks together. It has little compartments. So I've organized everything in there how I like it. And I have a couple extra little totes that I take. I also have a Nomad, which is, it takes radiographs mobily, which is super, super nice because I like to take working length or master cone checks, check radiographs, and it's just really inconvenient with Aspen only having one radiograph station basically. So they've set it up so I can use my Nomad in whatever operatory I'm in.
Nice.
Yeah.
And did you Was that provided for you by Aspen, the Nomad?
Yes, it was. I had to ask for it, but yes.
Nice. Um, so who is seeing your emergency and follow-up patients?
I do. So there's an emergency number that you can either use your phone number, or Aspen will set you up with Telemed, which is an app that they'll have a phone number where you can, that's what I give my patients. I give them all a post-op sheet that has that emergency number on there. And if they need it, they can call it, and then it texts me and I can respond or call them back. I can call them back using the app. So it kind of codes my phone number, or I just call them with my cell phone. Most of the time I don't care if they have my cell phone number, so I'll just call them back with that. But I like to follow up on them. So even if they call the office, usually the front desk will email me about it or text me, and I'll just say, oh, hey, if it's not emergent, like put them on my schedule for a post-op, or I'll call the patient and see how they're doing if it's more emergent like that. But I like to follow up on that rather than the general dentist, just because I don't want them to I just feel more comfortable.
Fair enough. Do you have options to use things like nitrous oxide in the office?
I don't actually. I am certified for that, but they don't have nitrous oxide in any of the offices that I'm in, which actually, for endo, it's kind of nice not to use it because it's kind of in the way. But I do offer oral sedation, so just minimal sedation with triazolam or halcyon. And I have a pulse oximeter that I use throughout the appointment, and I do charge out for that as well. So patients are aware that it's an extra cost. So if they're super anxious, I will offer that. But that's a pretty good replacement for nitrous.
Sure. Do you buy your own files and burrs?
Nope, Aspen pays for everything. Anything that I want or need, I basically, I can order pretty much whatever I want. You guys have never said no to anything, which I really appreciate.
We're a yes company.
Yes, I love it.
How are your hours? I guess the question is, how many hours are you working per day, and how many cases do you treat daily?
So it's really up to you what you want to do. But for me, I would rather work 3 long days and have 4 days off. So I usually just work 3 days a week, and I work 7 a.m. to 7 p.m. But sometimes I'll add patients. So and I get there usually an hour before. So I'm usually there like 6 a.m. to sometimes it can even be like 9 p.m. if I decide to add extra patients. But I set my hours at 7 to 7, 3 days a week. Sometimes I do 4 days a week, but most of the time it's 3.
But the important thing, right, like you said, is that's your preference. You would
Yeah,
rather do 3 long days. Yeah. So it's kind of nice because you do have the autonomy over your schedule in that way.
Yep. And it's kind of nice for patients too, like offering the 7 to 7, because some people like the really early and some people like coming in at night, and that's not offered very often in endodontist's office. So,
Sure.
so that's nice for patients, but it's also nice for me because I only have to work 3 days.
Yep, that works for me. Okay, so do you ever cover multiple offices in one day? I guess the answer is no, since you're doing 7
Yeah.
to 9 in one office.
That'd be a lot of work to transfer all of my stuff and like pack everything up. It's kind of my assistants do all the packing up and taking out, but I transport everything. So it would be quite a hassle to switch offices during it. Plus none of my office, there's one office that's like a mile from each other, or 2 offices that are a mile from each other, but otherwise they're not very close to each other. So that wouldn't really work very well.
Yep. So a few questions came in kind of about the interview process and things like that. So I'll try to group these together. I guess the order that makes the most sense would be, how did you manage the job searching process while you were in residency? And how did you know when you were ready to make a decision?
Well, job search in residency was very difficult, especially because I wanted to be in Portland and it's a little saturated out here. And it just, my private practice job, that kind of came about like super last minute, like June before I was, well, May before I was about to graduate. So like a month before I moved out to Portland, that kind of came through. And then it just, I don't know, wasn't quite the right fit. And then Aspen kind of came into the loop. So I would just say, well, actually, I'll also tell you that corporate dentistry scared me, like it probably does a lot of people. And I was very nervous about it. But interviewing and talking to everybody at Aspen, I felt comfortable because they gave me a lot of autonomy and let me do kind of, they didn't dictate my treatment at all. Like I do exactly what I want to do. And I talk to my patients. I have enough time to do what I want to do. So that made me feel better. And then actually working there, like confirmed all of that. They let me treat patients how I want to treat them, which is great. So the job search and residency was difficult, I will say that. But if you're going somewhere rural, you'll find a job. If you're going somewhere that's a big city, it's going to be a lot more difficult, but don't let corporate scare you away.
Oh, that's my favorite story to hear. I love when doctors talk about that. How you're like, kind of like afraid of the big bad wolf in the beginning, but then, you're with us full time now, which is just, it's great. If you wanted to work more than 3 days a week, for example, 5 days and maybe some weekends, do you get compensated for it? So I guess that's kind of like a good segue into how do you get compensated?
Yeah, so compensation, I'm paid a percentage based on my production. And there's a couple little fees that come out of it, but they're pretty minor. But yeah, I basically get a percentage. So whatever I do is what I'm making money for. So if you want to work 5 days, you can work 5 days. It's based on your production. So technically I could make the same if you're working a normal 40-hour week at 5 days in my 3 days working long days. So it's whatever you're doing is however much you're going to make basically.
And then as far as compensation goes, a few questions about the earning potential at Aspen. Obviously, it's a percentage like you mentioned. So we can't give exact numbers because it's based on the individual's production. But I guess just maybe if you could say what the earning potential would be compared to maybe a private practice or, yeah.
Private practice, a lot of times you're not taking insurances that Aspen is taking. So you're going to get compensated better as far as like per treatment, just because you're going to make more. You're not taking insurances that aren't going to pay you very well. But that's if you're busy too. So if you're at a private practice that's not very busy, then you're probably not going to do very well. But if you're at Aspen and you're seeing a lot of patients, or you're just seeing patients, I mean, I have self-pay patients, and then I also have some DHMOs, which aren't great, but it really evens out. So, I mean, basically my private practice, I made the same percent as I am making at Aspen of my production, but I'm making more at Aspen, but that's just because I'm busier. I wasn't very busy at my private practice. So it just really depends, I guess.
Sure. So this question, so the first part of this question you kind of answered already. Did you join Aspen straight out of residency or did you work somewhere in between? So kind of both, right? You said before you're working with us part-time.
Yep.
So the second part of the question though is, did you feel like you were prepared to take on difficult cases on your own without a mentor oversight?
Actually, so my first private practice job was with 2 endodontists who were like 50 years old. So it was actually really nice working with other endodontists. I did like that aspect of private practice. And I don't really have that here, but I feel like I got a really good knowledge base from working with them and from just my residency. I went to a really, really good residency. And so I feel like I had quite a bit of knowledge, and actually now it's kind of nice educating the general dentist that I work with. since I work with the Aspen or general dentist, if I have a case that I'm concerned about, or I have some questions, or I just want to, it's like a teaching moment or something, they're so open to discussion, and they want to learn. So I'm actually even doing a little lunch and learn type thing for a few of the dentists, because they were had questions on just diagnosis, which we think is easy, but just dental dentists aren't taught the same way we are. So I just like how I can work with them and teach them. And if I have a question about a case, I can just run and go get them real quick and be like, oh, hey, instead of calling them and them not answering. And yeah, it's a lot easier to have a dental dentist there.
Yeah, that's something that I think, Seth and I talk to a lot of, potential candidates about, is that in a private practice setting, like you said, it's a phone call, it's an email, it's a text message. You're not always getting the person right away. And then the patient's sitting in the chair. With Aspen, it's kind of nice to have that general dentist right down the hallway, because I always make the joke, if you have 10 dentists in a room and you show them the same x-ray, you'll get 11 different treatment plans. So when there's a discrepancy, you can just walk right down the hallway and say, hey, doc, come here for a second. We're going to talk about it. And you can come up with a plan and what's really in the best interest of the patient while the patient is still there.
Yeah.
So I'm glad that you brought that up, because that's a really big thing, I think, for the patients and for you as the doctor. Mm-hmm. This is a kind of a, not really Aspen related question, but what is your opinion of bioceramic as an endofiller with gutta percha? Little random procedure question thrown in there.
That's okay. I use bioceramic sealer, the Brassler bioceramic sealer. That's what I use for sealer. I do not use it as only as a fill. I still use gutta percha, but yeah, I love the bioceramic.
I'm not even going to pretend to know what any of that means, so we'll just move on. I hope that answered your question, whoever posed the question. So someone wants to know, is there a competitive hierarchy among Aspen endodontists that places added stress on new providers to produce? And I'll add to that with, are you competing with other endodontists in the Aspen network for patients?
No, I'm the only, well, there's like one endodontist that works in Washington, which is right across the border, but I'm not competing with him at all. And now there's one starting in the southern region, like down by California, Oregon. No, that I would say there's none. I'm pretty much the only endodontist in the areas that I'm providing for. So there's no competition or anything like that.
But you're the only endodontist in your offices?
Yeah. Yep.
So the question of, is there kind of like a hierarchy among endodontists, where I guess what they're asking is, the more senior doctors, are they placing stress on you as a new endo coming into Aspen? Are they putting the added pressure on you to produce more?
Oh, like the general dentist, you mean? Well, I'll just answer no. I don't get any pressure whatsoever from anybody in Aspen, the dentist, the owners, no one. I get no pressure whatsoever. I mean, I think I'm probably doing fairly well as far as just like treating patients in my production. But I don't compromise my care or my quality of care for that, and I never would. So if they ever questioned me on that or pressured me, like, absolutely wouldn't, I would not be working here. So
yeah. So you've never had that?
No, never.
All right, awesome. Can you choose your file system, or does Aspen have preferred vendors or brands?
I think they have preferred vendors, but if you have something that they're actually they're set up with a bunch of different systems. They had my files, and so I ordered exactly what I wanted. I know the endodontist that just started in the southern region of Oregon, he had something that they didn't have, and they found a way to order it. So if they're most likely they'll have what you want, and you can order what you want, but if they don't have it, they'll figure out a way to get it for you.
Awesome. I like this question. This is a really good one. because you mentioned before about kind of like having, not so favorable opinion of the corporate dentistry model. So the question is, how did your program director or your colleagues perceive your decision to pursue a career in corporate setting as compared to a more traditional private practice?
Well, I think that like my co-residents, I think that they would prefer me to be in my own private practice because then I would make more money, supposedly. But it's also a lot more work to work in a private practice. You have to run the whole business aspect, and you have to make sure that you're getting along, and that if you're in a partnership or a multi partnership, you have to make sure those people are on the same page as you as far as business wise, and that's very difficult unless you have known that person for a really long time to find somebody that you mesh with. So they understand why I am working corporate, and they would probably do it too if they were in my situation. But they also both live in like rural Iowa, so I mean, it's a lot easier to have a private practice there than it is here. So I wouldn't say obviously they've given me like said a few things, but it's when I tell them the reasons that I'm here, they're like, oh, I guess that makes sense. Like we would do that too. So.
Okay, let's see. Does Aspen offer CEs?
Yes, they do. They do quite often. Have I done any from them? No, and I should. But I mean, I'm signed up. I'm part of the AAE, and so I signed up for AAE on demand. And as far as specialists, they do have a few actually that they just released for endo, which will be nice. But I just like more specialized CE as far as endo goes, and they haven't quite offered that type of, they do a little bit, but the AAE has endo on demand, which is endo specific, which I like. So, but yes, they do offer CE and it's free.
And I'll take this opportunity to plug something that my boss on the academic team, Joel Lowsky, shout out, pioneered during COVID, and we're still continuing it. We are offering free CEs for anyone in the dental industry. You do not even have to work for Aspen. So just Aspen's little kind of contribution to the industry while the COVID pandemic is going on. I will send everyone the website for that in a follow-up email so you have access to it if you ever want to just hop on and get some free CEs while we're talking about them. So you mentioned before that you're doing a lunch and learn with with some of the general dentists that you work with. Do you ever do that with any of the endo residency programs?
Actually, I teach at OHSU as well. I don't teach the residents, but I teach the pre-doc students. So I not much with the residents. I guess I have interaction with them, but I don't do any really teaching for them, just because I was hired as a pre-doc teacher. They needed those more. So yeah, I guess sort of. I teach dental students, but not residents.
So a few COVID questions. The question is, how have the practices changed during the COVID pandemic? Are you seeing less patients, which I know you mentioned earlier that you are giving a little bit more time? So I guess just kind of go over what the new protocols and procedures are and just kind of what's changed with the COVID situation.
Yeah, so each patient that checks in, they have a screening questionnaire that they're asked, and it's filled out, and their temperature is also recorded. But it's basic questions like, have you traveled to any of the hot spots? Have you traveled outside of the US, which I don't even think you can do anymore. And then have you had a cough or anything like that? And then they also, if they're not wearing a mask, they give them a mask. But in Oregon, it's required to wear a mask wherever you're at. So most patients already have them when they come in, but if they don't, we give them a new mask. And then as long as they have answered no to all of those and they don't have a temperature, then we can see them. And it's like I said, I expanded my treatment times to help with the sterilization in between, making sure everything's clean, and I just decreasing the overlap of patients that are sitting in the waiting rooms, because we don't want that. And also, a lot of offices aren't even letting people sit in the waiting rooms. We'll have them sit in their car, which is really nice. And then we'll just call them when or they call us, check in, we call them when they're ready to come in, or we're ready for them. And then as far as the general dentist side, I'm not quite sure exactly how much they've changed their schedule. I know they have, but I don't really focus on that because each office is different. But as far as endo goes, I definitely have adjusted and increased my times in between, because I just don't want patients waiting around or overlapping.
Sure. What about PPE? Are you being provided with
Oh.
N95s? Are you being provided with all the necessary PPE?
Yep, N95s we have at every office, and they even shipped me some personally, which was great, just to make sure that my team has some at all of the offices. And honestly, I don't know how some private practices are doing, or even general dentist offices are doing in this pandemic, because it's been pretty hard to get some of the PPE, like hand sanitizer, things like that. But Aspen has been on top of it, which is amazing, because we pretty much always have supplies, which is great. And I know a lot of general dentists are out there struggling with that, and even endodontist offices are struggling with that. So PPE has been amazing.
That's awesome. Benefits. What kind of benefits does Aspen offer to you as a full-timer? And then if you know what benefits are offered as a part-timer, if you don't, I can always jump in and answer.
That's a good question. The only benefit I know that I am using is the 401k, which is a really, really good thing here at Aspen. It's way better than what private practice offered me. And I know I'm taking advantage of that. As far as like health and insurance, I don't need that because I get that through my husband. But I know they offer it. But I also know you can get free dental care as long as it's like preventive stuff, like cleanings and stuff like that, and you get a significant discount as far as that goes. So that's the main thing I know that I've taken advantage of, 401k, which is pretty awesome. So
yeah, I'm sure even without dental insurance, you know a couple dentists that can help you out, right?
yes.
So we do offer 401k to our full-time specialists, and also medical, like Dr. Case mentioned. And also if you're part-time, something really nice, because a lot of companies don't offer benefits to part-time employees, but Aspen does offer medical benefits to their part-time specialists. So that's working at least 1 day a week. So if you're working, let's say, at least 4 days a month, you will be eligible for medical benefits, which is really nice.
Oh,
Yeah, I'm sorry. I
sorry.
wanted to add mileage. We pay mileage for part-time
Mm-hmm.
as well as full-time. And last year, in January of last year, we started for our full-time specialists, they're eligible for a company car. So you have that option as well if you choose not to have the mileage.
Yep, that's
Awesome.
what I was going to say.
Oh, good, because I forgot that. So what do you like most about Aspen?
The most I like my flexibility with my schedule, because I like to travel a lot and it allows for that. And yeah, just my flexibility, my schedule has been great. But then also the fact that I can use whatever I want for treatment, that's not dictated, and I can treat people, like I can schedule the amount of time that I need, and I'm not pressured into anything. That's what I like the most. I have what I need to work with, and they let me do what I want to do.
And the follow-up question to that is, what do you like the least?
I would say I wish I had a cbct in every office, but I've been able to work with that.
And that's coming soon.
Yes. Actually, one of my other offices, I'll have 3 offices that have them very shortly. It arrived, it hasn't been installed yet, but 3 of my offices will have them. So that's definitely better than my 1 that I started with.
Yep.
And then, you know, traveling does get a little old. My farthest office is 3 hours, like 3 hours and 15 minutes away, but I only go there once a month, so it's not that bad. Oh, and also if you travel and you need to stay overnight in a hotel, they will pay for that as well, which is nice because then I kind of loop all of my southern ones into a week so that I don't have to travel quite as much. But really, I would say those are the main things, just like the cone beam, but it's going to get better.
Yep. Does Aspen cover your malpractice insurance?
Oh, they would. Well, they offer their own company, but I already had a company, and so they basically reimburse me for that each month. So I pay annually, but they send me a check every month to reimburse me for that. So I just send them the new updated declaration or whatever it's called each year, and then they reimburse me every month for it.
Can an endodontist be a practice owner?
I don't think so, and I don't know why you would want to put all that work on yourself when it's pretty awesome without that.
That is the correct answer.
Wouldn't want that hassle, believe me.
Right.
Just go in and do what you need to do.
That's it. Treat your patients, right? That's what you were trained to do.
Yeah.
Once you decided on Aspen, how long was it before you were working? Example, did you need to wait on equipment, any extra red tape because of the corporate? And someone is also asking what the interview process was like. So I guess maybe you can talk about your interview process going into your onboarding.
Yeah, actually, I think Seth reached out to me, and at first it was just like a text, and I was like, "How did you get my number? This is kind of weird." And then I was like,
We get that a lot.
And then like a month or two passed, and I was like, maybe I am interested. Let me just hear this guy out. So I contacted him again. Well, actually, I think he contacted me again, and I was like, okay, let me hear what you got. And then I was at a point where I was like, you know, let's just do it part-time and see what it's like. And I did, and the interview was pretty simple, really. I just met with the area manager, territory manager, I don't know, one of the higher ups, Becky, and we just talked for, I don't know, like an hour, maybe not even. And it was very casual. It was nothing where you would sweat about an interview. It was just kind of like meeting her and seeing how it works at Aspen. And then they pretty much hired me within like a week, I would say, of that. And that was in like January, but I didn't actually start till April. But it takes a while for all of the offices that you're working for it to get the insurances to accept you. That's for any office, really. I mean, it'll take at least a month for the insurances verifications to come through. And so I started in like April, I think the beginning of April, but it takes some time for the supplies to come in, but mostly it's the insurance verification that needs to come through.
So what was the time? I didn't catch the first part as far as what month you interviewed. So what was the time frame from, let's say, interview to when you started?
January, I interviewed, and then I started like the first week in April. So it was like the end of January and then the 1st of April.
Oh, nice. So not too long at all.
Yeah.
Let's see. Okay, so we have a question about, so you mentioned earlier that you do some surgeries. So that was a question coming in about the specific procedures that you're doing, and do you do any surgeries? So if you could just elaborate a little bit more.
I love to do apicoectomies, so I'm super happy that I can still do those at Aspen. I do require cone beam CTs for those, so I make sure everybody has one of those. And then, yeah, I love doing apicos, so I definitely do them. And retreats, and I don't love retreats, but I do them. And I do regular treatment. So pretty much all endo. I do root amps. I do pretty whatever endo you could think. I do intentional replantations. Yeah.
Awesome. So that's all the questions that we had come in. But I just wanted to end with, I always like to end with, for everyone that's listening right now, if you could give them, most of them are residents. So if you could give them like any piece of advice, what would that be?
Do what makes you happy. Don't get stuck in something that you don't like. And Aspen is actually really great. You can treat patients how you want. So just make sure wherever you end up that you can do exactly what you want and what you think is best for the patient. And I know Aspen definitely does that. Otherwise, I would not be here. And I promise you that. And everybody that works with me, you guys all probably know that, that I don't really compromise on anything. So just don't compromise.
That is great advice. Seth, do you have anything to add?
No, I think tonight was great. I think Dr. Case covered a lot of different topics and provided a lot of detail. So I'm super excited. I thought this was great tonight.
Me too. Me too. And we have some messages coming in. Everyone is saying thank you so much and they learned so much. And so thank you, Dr. Case. We really appreciate it.
Yeah, you're welcome. If you need to
You
reach
did
out to
awesome.
anybody, you can email me or something.
Sure. Yeah, if anyone, has any other questions, we'll connect. And then I could always, get you connected to Dr. Case as well, if that's something that you want to, talk to her further. But you did so well, and this was so informative and great, and we really thank you so much.
Awesome.
Thank you,
All
Dr.
right,
Case.
guys. Thanks
All
for
right.
hopping on, everybody. Thanks for listening in and watching, and we'll see you soon, hopefully.
Thank you, everyone.
Thank you.